Hi, everyone. So I'm the next program head to introduce the perioperative program. And perioperative is just another term for operating room. So next slide, please, Julie. So what is perioperative nursing? So for those that are unfamiliar, perioperative nursing ensures safe care and provide patient care for those that require surgery. And just on the slide, there's a list of a few examples of surgeries that you may have heard of or even experienced yourself. So there's a huge range. So we go from ortho surgeries like knee scope, knee replacement, gynae surgeries like cesarean sections, and also general surgeries such as gallbladder removal and also appendix removal. So those are just a short list of the amount of surgeries that are available and that we do. And one of the most rewarding parts about being a perioperative nurse at the end of the day is just to be able to help fix a problem and ultimately give the patient a better opportunity for a quality of life. And then so many people may assume that perioperative nursing doesn't really involve direct patient care, but in reality, they do. It just looks different. So perioperative nurses support patients receiving surgery through two main roles, and they're called the scrub nurse role and also the circulating nurse role. The scrub nurse role is often portrayed on TV that you've probably seen as part of the sterile team. So they're all gowned up in the blue gowns and they're kind of amidst the action, assisting with the surgeon. So in reality, they do assist the surgeon by preparing the equipment and also supplies, and they work very closely also to the circulating nurse. As they are a very restricted kind of in their as sterile team members. On the other hand, you have the circulating nurse role, and they're the ones that you usually see checking patients in, setting them up for surgery, and they help monitor and ensure the needs of the patient and also the rest of the surgical team. And similar to when you're taking off on an airplane, the circulating nurse just makes sure everyone's on the same page and ready to go before the surgery commences. Now, both roles provide patient care and advocate for patients, especially this being one of their most vulnerable times. Most of the time when you're in surgery, you're under general anesthesia or conscious sedation. So perioperative nurses are essentially the patient's like eyes and mouth, right? So speak for them and watch for kind of safety issues for them during that time. One of the challenges that you may see with perioperative nursing is gathering pertinent information, especially during check-in, because our check-in window is quite small. Like within 5 minutes, you're trying to build a nurse-patient relationship and that trusting relationship in that short amount of time. And so who is this for? Like Kathy mentioned earlier, we offer in perioperative program, we offer 3 pathways. So one of them is for RNs and BSNs who would like to work in the OR and also obtain an advanced certificate in the perioperative specialty nursing. We also offer it for LPNs who would like to also work in the operating room. And it's a very similar format to how we deliver the pathways similar to the RNs and BSN. And we also have a special pathway for perinatal nurses. And these are nurses who work on the maternity unit. And oftentimes the unit has their own surgical team that does primarily C-sections. So we prepare the nurses and expand their scope of practice to be part of the C-section team. And then to be successful in our program, I would like just to mention a few attributes that may be helpful to have. So some of the things that we've seen is having a strong interpersonal skills and excellent organizational skills. You might say a lot of the perioperative nurses are a little bit OCD, but I think that may be similar to a lot of other specialties that you may hear of. You also have to have the ability to work very closely with your surgeons and also anesthesiologists and a lot of people in the room. So good communication skills is very important, and also being proactive. Also energy. I know that in the OR, it's like you're standing for a long time, so you do have to have a good physical stamina. All right, and then just on the slide here, you're going to see that this is what our program looks like. It's basically 25 credits in total, with 3 theory courses in blue and 3 clinical courses in the pink. The first theory course is just the foundation overview, and then followed by the second theory course, 7250 or 7251. That's the scrub nurse role. And that's usually followed by a clinical, which is all about the scrub in 7350. And then you go back to the circulating nurse role, which is in 7450 and 7451. And then again, followed by a circulating nurse clinical rotation. And then the very last clinical, 7750, is the consolidation of both scrub and circulating nurse role. So that's kind of our 25 credits in a nutshell. And our theory courses are all available and delivered online, so distance learning. And then our perinatal program that I spoke of earlier, that's a modified pathway, so it's only 10 credits. And then so our graduates of the program are able to work with patients ranging from infants to elderly. As you know, surgeries happen to, can occur in all ages. You're able to work in rural or tertiary care units. So it can be in the hospital. It can also be in private surgical centers. And there's also opportunities for the perioperative nurse to expand their roles as RNFA. So that's the first assist. They are usually helping with their in surgery, helping with a surgeon in a more expanded role. All right, and we also have a little video for you from one of our past students. And it's about 1 minute video, and she's going to share with you her experience of the program.
So I completed the BCIT Perioperative Specialty Nursing Program in 2020, and what I liked about the program was that it was offered in a very organized way, where we did the clinical portion at the hospital and the theory portion at home through online learning. And before we went on to do our clinicals, we had a chance to practice and apply what we've learned in sim labs, and this was done in a small group setting, so we were able to receive immediate feedback on what we did well on and what we could improve on. And all the instructors were very engaging and knowledgeable throughout the whole program, and also shared with us some of their own real-life experiences as OR nurses. And I feel that this very well prepared us for clinicals. And overall, BCIT program provided plenty of time and resources for me to learn all the appropriate skills and basic knowledge prior to starting my career as an OR nurse.
Perfect. And just on this next slide is just a few other students, past students that we had, and what they have said about the program and their experiences with perioperative nursing. So I'll just give you a few minutes to look over that. And just like Julie said, you will be receiving the slide deck and this presentation, so you guys can always review what they said afterwards. And the next slide, please. I'll just, we have our contact information, so you can reach out to me through phone or email, and also the program assistant, Stephanie Strong, and that's her phone number and email as well. Thanks, everyone.